Welcome, everyone. Thank you for joining us for another digital info session. My name is Mary. Before we begin our event this evening, I'd like to go over how this session will work. We'll be recording this and it will be available to watch on our Facebook page and our website soon after. If you have any questions, please use the Q&A box at the bottom or top of your screen, and we'll try to answer as many questions as we can. Some of you may not be familiar with our organisation, so I'd like to tell you briefly about who we are and what we do. Myoma UK exists to support all those affected by myeloma and its related conditions, which includes smouldering myeloma, MGUS, and AL amyloidosis. We are patient-focused and aim to empower, inform, and support patients in everything we do. As an organisation, we rely on the generosity and kindness of supporters who fundraise and donate. Myoma UK is a charity solely funded by our supporters. We receive no funding at all from the NHS or government. Everything we do is funded by voluntary contributions, fundraising, and gifts, lefts, and wills. We are truly thankful for all your contributions as they allow us to continue working to help patients, their families, and their friends, and put on events just like this one. Tonight's digital event is a question and answer session with two of our lovely myeloma information specialists, Ellen and Rebecca. Thanks for joining us. They work on our Infoline and Ask the Nurse service and are here with their expert knowledge to answer as many of your questions as possible. So let's get started. I'd like to hand over to Rebecca, who will give you a brief overview of the service and their roles.
Thank you very much, Mary. Just as Mary said, I'll give you a bit of an introduction to the Myoma Infoline. The Myoma Infoline is a confidential service which provides information, emotional support, practical advice, and a listening ear. Just to say, the information you receive from our myeloma information specialist is general and should not be considered medical or clinical advice. It should not be used in place of specific personalised advice from a qualified healthcare professional. We're very proud to say since 2004, the Myoma Infoline has been accredited by the Helplines Partnership, which is a nationally recognised quality standard which defines and certifies best practice in helpline work. So when you call the Myoma Infoline, you'll speak with one of our myeloma information specialists who have all have an in-depth understanding of myeloma and its related conditions and are all supported by medical and nursing advisors. Calls have no time limit and you can talk for just as long as you need to. There are 4 myeloma information specialists currently. There is the lovely Ellen, who's on the webinar with us tonight. We also have Em and Hayley and myself, and we all work really closely together, sharing our information and supporting each other in our work. We also have a fantastic team who are trained to take messages should all the myeloma information specialists be busy, or you can leave a message on the answering machine and somebody will call you back just as soon as possible. The Myoma Infoline is open Monday to Friday, 9 a.m. till 5 p.m. and it's a free phone service for calls within the UK. And should you think of a question out with the 9 to 5 opening hours, we also have an Ask the Nurse email service. So with that service, we aim to respond to your email within 3 working days, but replies are often quicker than that. And that's me.
Thank you so much. We'll now jump into the questions. So thank you to everyone who's already submitted these in advance, and please keep adding to using the Q&A box during the event today. And so the first question goes to Rebecca. This is from Francine. Francine says, are there any painkillers one can take just to lessen back pain when out and about? I've been on a plateau for 8 years and 2 hip replacements have greatly improved my mobility, but my back does not like standing or slow walking in particular. As soon as I sit down, the pain stops and I don't want to take lots of medication, but wondered if there's anything effective I could take before indulging in any activity that causes discomfort. I've tried exercises to strengthen core muscles, but that doesn't solve the problem.
Okay, so thank you so much, Francine, for your question. It's a really good one. First of all, it's really great to hear that you're in plateau and that your hip replacements you feel have improved your mobility. And just to say, it is really, really good to stay as mobile as possible and as fit as possible, but also just to listen to your body and only do what feels good for you. So in terms of painkillers, there are different painkillers with varying actions, which suit different patients at different times. For example, we have things like slow release painkillers, or we have fast acting. And it may be that something fast acting could be a good option in the circumstances that you've described. You also mentioned that you don't want to take lots of medication. So you could consider taking the pain relief only when required. For example, maybe just an hour before you go out and about on your walks. I would also encourage you to speak with your medical team, that's your GP, your hematologist, and or your clinical nurse specialist, about which options they think would be best for you, because they have all access to all your medical notes and history, and they know you best. And when speaking with your team, we always say it's a really good idea to try to describe your pain just as accurately as you can. If you can do this, then that can help the team to identify the cause of your pain and also to prescribe the most effective method of pain management for you. I wanted to just say a little bit about NSAIDs, which are non-steroidal anti-inflammatory drugs. Examples of these are ibuprofen, diclofenac, naproxen, and high-dose aspirin. And just to let everybody know that these are not suitable for myeloma patients because they can be really harsh on the kidneys, and they can already, any kidney damage existing can be worsened by them. So steer clear of those. Also, just to mention that if you feel that you have any new or increasing pain, or anything that wasn't there before, then that's something to make your medical team aware of. And there may be some other options as well as pain relief that you may wish to consider with the team. Perhaps you could have a mobility aid, and for some patients, physiotherapy is an option to help with mobility. And then finally, just to say that we have some brilliant resources on our website. One of them is our Pain and Myeloma Info Guide, which looks at the causes of pain, the treatment of pain, and living with pain. And then we also have a sheet, an info sheet, which has exercises, gentle exercises, which are suitable for most myeloma patients. But we always do say, before you embark on anything new, just to run it by the team as well to make sure it's suitable for you.
Lovely, thank you, Rebecca.
You're welcome.
So the next question comes from Neil. This one is for Ellen. Neil says, since going through the VTG program and stem cell transplant in early 2022, my weight has stayed pretty static, but my stomach has enlarged and I have a pregnant look. I guess this could be age-related as well. I'm 59, but could you offer any advice? Exercises need to be impact conscious due to bone discomfort. I hardly drink any alcohol and don't smoke.
Yeah, so that's a good question. And it's a tricky one as well, because it could be down to any number of reasons. It could be related to what you've gone through with your myeloma and treatment, or it could be completely unrelated, which is again why I would say please do let your team know any changes, anything new or increasing. Your team will want to know about it, just to perhaps investigate what may be going on. In our experience, we know that often a protruding stomach can be due to the bone damage to the spine that the myeloma causes. Sometimes you can have what's called vertebral compression fractures, which means the bones of the spine just kind of collapse in on themselves, and that can cause your torso to become a little bit more compacted, and for there to be an appearance of a protruding stomach. So if you've not got any damage to the bones of your spine, then it may be another issue that's causing your protruding stomach. Of course, we often think about gastrointestinal issues like constipation, diarrhea. If those are absolutely all okay, then again, your team just might want to have a wee look at your tummy, maybe do further investigations just to find out what might be going on. But certainly a question for your team. It'd be great for some healthcare professional, your doctor or nurse specialist, to get their eyes on your tummy and maybe just to give you a full and thorough examination.
Thanks very much, Ellen. So the next question is for Rebecca, and this comes from Paul. Paul says, I had a stem cell transplant in April 2023. I am 74 years old. I'm just wondering, does age have anything to do with how soon my myeloma might come back? At the moment, I'm in full remission and leading an active life, i.e. walking, table tennis and pickleball, and of course, going on holiday. So I guess the first question is, what is pickleball? I am going to have to Google that. I'm not sure. But maybe Rebecca could help with the rest of the question.
Thanks, Mary. Yeah, I don't know what pickleball is, but it certainly sounds like a lot of fun. So hi, Paul, and thank you so much for your question. It's great to hear that you're in full remission, and it sounds like you are leading a really busy and active life, which is fantastic. So there are a few things that can affect relapse, and what I'll do is I'll try to go through a few of these and then relate it a little bit to age as well. So myeloma, as you probably know, is what's known as a relapsing and remitting cancer. This means that once patients are diagnosed and their myeloma is active, they will have an initial treatment and generally go into a period of remission or plateau, at which point the myeloma is not active and is often not being treated. Following that, there will be a period of relapse, a period when the myeloma is active and needs to be treated again. So myeloma is a very individual cancer, and some people will have long remissions and some will have shorter remissions. And generally speaking, the first period of remission is often the longest, with subsequent remissions often being shorter. So there are generally two main treatment pathways for myeloma patients. There is an intensive treatment pathway, which you, Paul, mentioned that you had, which involves high-dose therapy and stem cell transplantation. And although there's not a rigid cutoff point in terms of age for this treatment, it is one that is generally a good option for perhaps younger, fitter patients who have less other medical conditions or comorbidities is what we call that. And then just to say, the less intensive treatment pathway, which involves not the stem cell transplantation, but instead different combinations of anti-myeloma drugs, can also be very effective in treating myeloma for patients who are not eligible for high-dose therapy and stem cell transplantation, who may be older. A really good example of this is DRD. So that's a combination therapy of daratumumab, lenalidomide, and dexamethasone. And Myeloma UK campaigned really hard to get this treatment and make it available to newly diagnosed myeloma patients who were stem cell transplant ineligible, excuse me, not eligible for a stem cell transplant. And clinical trials have shown that DRD could keep myeloma at bay for at least 5 years on average. So that's a really good outcome. Other age-relating factors to consider are that myeloma is more common in adults over 60, with most cases being diagnosed around the age of 70, and that cases for people under 40 are pretty rare. Aside from age, the response to treatment and how quickly a patient may relapse can also be influenced by something called cytogenetics. And those are the different types of genetic abnormalities in the chromosomes in the myeloma cells. So there are a couple of tests which can be used to look at these changes in the structure of the chromosomes. One is called a FISH test. So that's a fluorescence in situ hybridization test. And the other one is called karyotyping. So these tests can give more information to the medical team about a patient's myeloma and how aggressive or how difficult it may be to treat. So you may be told if your myeloma is standard risk or high risk or very high risk. And if you do have high or very high risk myeloma, it doesn't necessarily mean that your prognosis is worse. However, it can mean that a patient may not respond as well to treatments and that the periods of remission may be shorter. So if you are high risk, your medical team may choose to offer a different treatment approach and it may be more intensive. And then finally, I just wanted to speak a little bit about future directions in treatment and monitoring. So there is something called minimal residual disease, or MRD. And the cells which are left over after treatment are called minimal residual disease. And over time, what happens is these can multiply and cause the myeloma to become more active again, which is relapse, at which time more treatment will be needed. So measuring MRD allows doctors to have a more detailed understanding of the number of the myeloma cells which remain when a patient is in remission. So researchers and doctors are still investigating whether minimal residual disease can guide treatment options for myeloma patients, but it's hoped that the test will eventually help them to know how patients are responding to treatments and when they need to change or restart treatment after a break. MRD testing is not widely available on the NHS at present, but it is used as part of some clinical trials. And in these clinical trials, they show strong evidence that an MRD negative result in a myeloma patient is a good indicator of long-lasting remissions. So yeah, there are many factors that can influence when a patient may relapse. And it's also important to say that there are many treatments that may be available to patients at different stages of relapse, as well as a really busy research pipeline of treatments which may soon become available to patients. So the outlook for many myeloma patients, is looking better now than it has been in the past.
Wonderful. Thank you, Rebecca, for that very comprehensive answer. Appreciate it. And so the next question is for Ellen. Linda would like to know, can you advise how often myeloma patients are eligible for COVID boosters, please?
Absolutely, and this is a question we get asked quite frequently, as you can imagine, on our helpline and on our Ask the Nurse email service. So a news alert has fairly recently gone out just to let everyone know that the Spring 2024 booster programme will be beginning shortly, and you will be contacted by the NHS from the 22nd of April. Some will be a little bit earlier, so watch out for that contact from the NHS, be it in a letter or a text or an email, and you should go ahead and have your boosters. Up until the 2024 Spring Booster Programme, patients with myeloma will have been offered at least 9 doses of the COVID vaccine. That's usually includes 3 primary and 6 boosters, and those are available for anyone who's deemed to have a weakened immune system, which absolutely myeloma patients have. So have a look at our website at the Spring Booster Programme.
Great, thank you, Ellen. The next question comes from Robert. Robert says, I completed a 6-month course of DVD and now 6 months later still have peripheral neuropathy in my feet and fingers. How long should this last after the end of treatment, or could this be permanent? Rebecca, are you okay to take that one?
Yep, I'm good to take that one. Thank you, Mary. So hi, Robert. Thank you so much for your question. And again, this is one that we do speak to people a lot about on the Infoline and Ask the Nurse service. So just to give a bit of background on peripheral neuropathy, what that is it's a damage to the nerves that make up the peripheral nervous system. So that's all the nerves outside the brain and the spinal cord. And as you mentioned, Robert, it most commonly affects the hands and the feet. So when the peripheral nervous system is damaged, the messages that are carried between the body and the brain are interrupted or distorted, and this can cause a variety of symptoms, and these include numbness, tingling, a lack of coordination or a loss of dexterity. Some people feel altered sensation, such as burning, and a lot of people feel pain. So the causes of peripheral neuropathy and myeloma are quite often anti-myeloma treatments, unfortunately, and both the bortezomib and the daratumumab that you mentioned you are having as part of your DVD treatment are unfortunately are culprits of causing peripheral neuropathy as a side effect. So coming back to your question about, how long, evidence from large-scale, well-conducted clinical trials shows that peripheral neuropathy caused by bortezomib typically does improve or completely resolves in most patients after 3 months after treatment has stopped. However, for some people it may take up to 2 years, and unfortunately in rare cases some patients' peripheral neuropathy will not resolve, unfortunately. So really, what can be done? It's important to tell your medical team very soon if you are experiencing or continue to experience the symptoms of peripheral neuropathy. If you're on treatment, it may be possible to lower the dose of your treatment or the way it's given. And sometimes it's possible to stop treatment if it is significant side effects for a short while until symptoms improve. Or if, as you describe, symptoms persist after treatment has finished, there are a number of options that could help as well. There are pain-relieving drugs such as gabapentin, pregabalin, and amitriptyline. And then some people find they get relief from using TENS machines. That works for some people. There are cooling and warming creams that can be helpful. And then for some people, a number of the complementary therapies can be really useful. So things like gentle massage, reflexology, things like that can be helpful. And just to make you guys aware, we do have a really good peripheral neuropathy info sheet on our website, which is probably appearing in the chat just now as well as our complementary therapies webpage. So they're both really worth having a look at.
Wonderful. Thank you, Rebecca. So the next question comes from Elaine. I am now on my 3rd line of treatment. I often have eye discomfort. Sometimes my vision is a bit blurred then. By evenings, my eyes are often dry and uncomfortable. I've had a recent eye test. Do you have any suggestions for managing eye discomfort and bringing relief? Ellen, are you okay to answer this one, please?
Absolutely, yeah. Well, I'm sorry to hear about that, Elaine, that your eyes are giving you some troubles. And like the first question that I answered with regards to the bloated stomach, it could be related to your myeloma or the treatment you're on for your myeloma, or it could be unrelated. So I'm glad you've been to see an eye specialist, and certainly an ophthalmologist. An eye doctor is the best person to see with any eye issues. And again, on our website, we do have an information sheet specific to this. It's called Eye Complications in Myeloma Info Sheet. So do find that one if you can on our website. So most eye issues that we hear about are related to the treatments that patients are taking for their myeloma. Sometimes it can be due to infection. For instance, there's a condition called blepharitis, which is infection or inflammation of the eyelash line there. And it's fairly common in the general population as you get older. So your ophthalmologist will either confirm or rule that out. We know, for instance, that long-term use of steroids can cause cataracts, and often when patients have been on steroids for a long time, they do need surgery to deal with those cataracts. But again, that's something the optician or the ophthalmologist will be able to diagnose. Many of the treatments can also cause dryness of the eyes, Velcade, for instance. And again, steroids are big culprits for this. The one concern that I often have when patients talk about blurred vision is that if your myeloma is very, very active, that means it's not in remission or plateau, then you will have high levels of paraprotein in your blood. And high levels of paraprotein in the blood can make the blood a little bit thicker and stickier than it should be. This is a condition called hyperviscosity, and the very delicate vessels at the back of the eye, the retina, don't like the blood to be too thick or too sticky, and that can sometimes cause blurred vision. So for sure, it's important that your hematology team, not just your eye doctor, your ophthalmologist or optician, so please do let your clinical nurse specialist and or your hematologist know about the symptoms you're having with your eye, and they will just want to make sure that you don't have this this condition called hyperviscosity. But if your myeloma is under good control and at very, very low levels, then that shouldn't really be the case. And I would just say, with regard to treating any dry eyes, you can get eye drops that you can use regularly, and again the ophthalmologist will make sure you have those. Bathing the eye in cooled, boiled, salty water is often a good thing as well. And just watching out for any signs of infection, any redness, any pus coming from the eye, any if you're looking at a bright light, if that's painful, do watch out for those signs and symptoms and let your doctors know again. But yeah, just keep your eyes nice and clean is generally the top tip. But keep an eye open for, well, sorry about that, yes, but do look out for redness and pus, and let your team know.
Great, thank you, Ellen. So the next question comes from Anna. Anna says, what questions should I be asking in the lead up to stem cell transplant? Is there any advice regarding the recovery period to make it as smooth as possible? I read something saying that you shouldn't be around pets after. Is this the case? Rebecca, can you take this one, please?
Yep, I can for sure. So that's, yeah, there's maybe 3 questions in here, so I'll try to address them all. And hi, Anna, and thank you so much for your questions. And I think these are ones that quite a few people who might be watching this evening will be interested in as well. So I just wanted to point out, first of all, you were asking about questions in the lead up to stem cell transplantation. So we actually have some fantastic resources on our Myeloma UK website, which can be really helpful to people in your position. We have an Ask a Nurse blog called Preparing for High Dose Therapy and Stem Cell Transplantation. And that one answers some of the most commonly asked questions leading up to stem cell. For example, what should I take into hospital? Really practical things like that. It's also important to discuss any specific concerns, questions, or issues you may have prior to your stem cell transplantation with your medical team, and they will be very happy to help. We have also a high dose therapy and stem cell transplantation info guide. We have these for autologous stem cell transplants, which is ones that use your own stem cells, for allogeneic, which are using donor cells, and we also have one for ALL amyloidosis. And these guides cover what you might expect from the high dose therapy stem cell transplantation process, stage by stage, as well as outlining the advantages and the disadvantages, things like what other drugs might be involved in your treatment, how often are they given, as well as some of the more common side effects. So that's really worth taking a look at. And then you ask for advice regarding the recovery period to make it as smooth as possible. So again, our info guide, which I mentioned above, does have a couple of sections that look specifically on recovery. The first one looks at the time directly following high dose therapy and stem cell transplantation. So this is a time when you'll be in hospital straight after, waiting for the transplanted stem cells to engraft. And what that means is the stem cells have to go into the bone marrow and settle down and start to produce these new blood cells. And just to mention, somebody on the live chat had asked about this and how long it typically takes for your body to regain a reasonable amount of immunity against infection for both bacterial and viral illnesses. So that period of engraftment lasts for about 2 weeks, and in that period, your body will be very, very immunocompromised. You'll be at a very high risk of infection, anemia, and bleeding, and your team will be monitoring you really, really closely. So during this time, you should take extra precautions to avoid infections. These can include bathing or showering daily, changing your clothes daily and your bedding daily as well. Some places might ask you to follow a clean diet, which involves avoiding foods which might introduce bacteria into your tummy and cause stomach infections. There will be restrictions on visitors during this time in the hospital, so it can be tough. However, with a bit of planning, you can maybe take in some entertainment with you, things like books, music, a tablet. And if you have your tablet or your phone, then it can be a really nice idea to FaceTime friends or loved ones, family, and keep in touch, and that you won't have them there, but you still will be able to see them in a way. So that can be a good idea. And then they'll be monitoring, your team will be monitoring your blood counts all the way through this process. And then when they feel they're high enough, and if you are free of infection, then you may be able to go home. After you're at home, the stage of recovery can last for months. And again, during this period, your immune system will still be low, it will still be recovering, but there will be regular outpatient appointments, and that will be being closely monitored. So your team will be able to let you know, just how robust your immune system is looking. What I will say is that it's important to know about the signs of infection and to speak to the team if you suspect that you might have an infection. And our infection and myeloma info sheet is a really good one. It goes over the tips for reducing the risk of infection and avoiding infection. It's just things like regular hand washing, using hand gels, avoiding crowded spaces, and if your loved ones are poorly in any way, then maybe just ask them to stay away until they're better. And also that particular info sheet talks about vaccination post stem cell transplantation. And I know that somebody else has asked a live question on that subject about having mixed messages about vaccinations and whether or not the consultant says you need them or not. So our vaccines and myeloma info sheet has all that information about which revaccinations you may require post high dose therapy and stem cell transplantation. It tells you when you should have them and how to get them. And just to point out, not every vaccination will be necessary for every single patient revaccination, and your team should be the ones to be able to advise on that. If you're not sure about the advice that they're giving, then you can always ask for a second opinion on that. Some people like to do that. And finally, that's a long one, you did ask specifically about whether or not you should avoid pets. So what we do say is that it's advisable not to get any new pets during the process of high dose therapy and stem cell transplantation. And particularly while your immune system is extremely weakened. And this is just because of the risk of infection is so much greater at this time. So extra precautions do need to be taken to protect yourself against any infection. You can already have, if you do already have a pet, extra precautions you can take are to wash your hands thoroughly after petting them, avoid really close contact, like face licking, these type of things, avoid handling their waste, so sort of dog poo bags or cat litter, maybe ask somebody else to do that for you, and avoid letting your pets up onto your bedding or up into the areas that you prepare your food. Just until your immune system has recovered. And as I've said before, your team should be able to give you an indication of, how that's looking through your regular tests. So just to say, we have a previous digital Infoday session, which is called on high dose therapy and stem cell transplantation. There's also the infection and myeloma info sheet, which I spoke about. And then just specific to pets, Macmillan have a pet care section on their website, and it has some really great information on caring for a pet when you have cancer.
Wonderful, thank you, Rebecca. So avoiding licking your dog's face, probably good advice for everyone, to be fair.
True.
And thank you for doing my job as well. You picked up 2 of the live questions. I could probably just pop off now. I thought you've got this covered. We'll move on. So the next question goes to Ellen. This is from James. James asks, what are my prospects after a very successful, nice 4th line treatment? I'm by no means needing palliative care yet. I've had my myeloma for 16 years and I am delighted with my treatment. My main symptoms now are fatigue and poor mobility.
Sure. Well, that's good. I'm pleased to hear, James, that your 4th line treatment has been very successful and that you're doing very well following that. That's good news indeed. As we have touched on this session, we know that myeloma is incurable but very treatable. And Rebecca has said already that we have such a busy research pipeline with new drugs coming along all the time. I mean, you might not know, but I've been at Myeloma UK for 20 years, and 20 years ago we had nothing like 4 lines of treatment. So things have improved a lot in recent years. This means also that survival has improved, so patients are doing much better, living longer, and with so many other treatment options. And you know, we always like to try and convey hope and positivity on our helpline, especially when we are speaking to patients who are newly diagnosed and probably terrified. You know, we do like to try and we're very realistic. We say myeloma is incurable but treatable, but we always like to include a note of hope and positivity because it's absolutely true. However, we also know that myeloma is very, very individual. It's probably one of the most complex and individual of cancers, and no two patients are the same. They'll differ in many ways with regard to how they respond to and how they tolerate treatments. It's good that you haven't needed palliative care as yet, but I just wanted to perhaps let everyone know that palliative care isn't always about end of life, isn't always about the very late stages of myeloma. Palliative care can often be used right up front. I mean, palliative care is basically supportive care, and for patients who have pain that isn't being managed particularly well, often a referral to a palliative care team is very appropriate. They can sometimes think of options that perhaps the team haven't thought of. That's what they do day in, day out, and they look at the patient in a very holistic way. So please don't worry if a palliative care is mentioned with regard to managing your symptoms, because it does happen. It doesn't always mean end of life, absolutely not. So the focus of care that a palliative care team will have will be improving and maintaining a good quality of life. So you know, please don't worry if a referral to palliative care is something that happens. And it's good to hear that you're doing so well. Fatigue, unfortunately, is something that we hear about quite regularly. Often, of course, the aim of all treatment for myeloma is to get on top of the myeloma and to manage any complications and their symptoms that it's caused. And for many patients, fatigue does improve, but for many also, fatigue is something that's ongoing. And what I would always say is never ever suffer in silence. If you've mentioned once or twice to your team that fatigue is a problem for you, please don't worry about mentioning it again. And if a referral to palliative care is suggested, absolutely fine. They may well be able to spend some time and look at you in a more holistic way. So.
Okay, thank you, Ellen. So the next question comes from Anonymous, and this is for Rebecca. It says, how do I support my husband when they don't want to discuss it? So I think this is probably around about myeloma in itself, just not wanting to talk about it.
Yeah, that's it. I mean, it's something that we do hear really commonly on the info line, and it is really tough. So just to say firstly, every patient, every person reacts differently to a diagnosis of myeloma. It can depend very much on a person's personality, whether or not they choose to discuss their myeloma. Some of us are talkers, some of us are not. And we do appreciate that this can be really hard for loved ones who may really want to talk about it so that they can understand and so that they can help. But there is no right and wrong. So I think, you know, what I would say is even just your husband, letting your husband know that you are there, if he does want to talk, is in itself really helpful. If he prefers not to talk at this stage, then it's really important to respect his wishes. It might not always be like that, you know, but you know, for now, that's how it is, and it may change or it may not. Some loved ones do find it really useful just to read up about myeloma by themselves. And we always say that knowledge is king, you know, so that they can gain that better understanding. And our website has a whole section, and it's called For Family and Carers. And that's a fantastic place to start. We also have an info pack for carers, which offers information not only looking on looking after the patient, but also on looking after yourself, because sometimes taking care of yourself is one of the best ways that you can support a patient. This can be taking a bit of time for yourself. It can be eating and sleeping as well as you can. It can be feeling that you can ask things of family and friends, you know, that is okay to do that. And I'm sure in most cases they will be happy, you know, to help. And also I just wanted to mention the variety of support services that you can use from Myeloma UK. So of course we've got the Myeloma Infoline, where Ellen and I and our colleagues are, you know, waiting to take your call. We also have support groups which run up and down the country, and they also run online as well. So that can offer a really friendly space where you can share experience with other people. And then another external that I will signpost to is Carers UK. So they are a fantastic organisation that we do signpost people to an awful lot, and they offer all kinds of support for carers, and they even have a wellbeing section on their website as well.
Wonderful, thank you. Just great to know there's so much support out there. So Ellen, this one comes from an anonymous user as well. Can we still have an intimate relationship? I'm worried about passing on an infection.
Very reasonable question, actually, and a lot of people do worry about asking these very sensitive questions, but you know, it's not something that your hematologist or clinical nurse specialist will not have heard before. So please don't worry about broaching these sensitive types of questions with your team. It is something they will discuss. And I know that some clinics, hematology clinics, do have specialist nurses specifically on sexual health and can sit you down and talk you through things. So there are a lot of different reasons why people feel worried about being intimate. Passing on infection is one, although that would be pretty unusual. Another is they're scared of hurting the patient, and you know, things change. Your life after a diagnosis of myeloma is not the life you had before the diagnosis of myeloma, and it's coming to terms with all of that and getting your head around everything that's new, and you know, it's not something that happens overnight, so please don't worry that it feels scary at the moment. Whilst patients are at increased risk of infection, myeloma patients are inherently increased risk of infection and will always have a somewhat weakened immune system. Passing on an infection during sex is fairly unusual. However, we would be a little bit concerned if a patient were on treatment. We don't know for sure. There's no absolute evidence about passing treatment through bodily fluids, for instance. So if you're on treatment for your myeloma, you will be asked to use barrier contraceptives when on treatment. A couple of resources that you might find useful on our website. We have an excellent Ask the Nurse blog on our website, which goes into this topic in a bit more detail. We have a publication called Living Well with Myeloma, for instance, which also has a section on sex and intimacy. So do have a look at those, and don't worry about asking those questions of your team and of us on the helpline. It is something that we do talk about quite openly. It's a sensitive topic, but and I know it's easy for me to say don't worry about asking these questions, but you know what, that's what we're here for.
Wonderful, thank you, Ellen. The next question is a live question from Solomon. Solomon asked, does one always have to have a bone marrow biopsy to determine / confirm if one is still in remission, or can the various blood tests be sufficient? Rebecca, are you okay to answer this one, please?
Yep, that's fine. Hi, Solomon. Thank you for your question. So if a patient is suspected of entering a period of relapse, there are various different tests and investigations that will be done to confirm that. And so Some of these are blood tests. So that would be things like your full blood count. So looking at the red blood cells to check if they are low, which may cause a patient to feel tiredness and fatigue because they have anemia. They would look at the white blood cell count, and if that is low, then there may be symptoms like increased infection, picking up more infections that you normally would expect to. And also they look for platelets, and if the platelets are low, then that can lead to bruising and so on as well. Sometimes there are tests, imaging tests as well, to look for things related to myeloma bone disease, so lytic lesions, and sometimes it is necessary to carry out a bone marrow biopsy, but it's not always the case, not for every single patient. So your team will let you know what they feel is necessary for yourself. So those, and then the other things they'll be looking out for are the measurements of paraprotein. So that's that abnormal protein that is produced by the myeloma cells in the bone marrow. So they would be looking out for increases in the paraprotein and also in the light chains, the free light chains, which are a sort of part of the paraprotein. They're made of heavy chains and light chains. So that's the other part. And any rise in these, and it wouldn't just be a one-off rise, it would be a significant upward trend, maybe over a few different test results, 2 to 3 test results, and they'd be looking for a trend rather than a one-off, because results can fluctuate as well. So they'd be looking out for that. And then there's a few different sort of tests that they can do as well. So these can be tests to check how well the kidneys are working, calcium tests to see how much calcium may be present in the body. Also a beta-2 microglobulin test. So that looks for protein that's present on almost all the cells in the body. But it's increased in myeloma. And then there's another one called albumin, which is a type of protein which normally makes up most of the protein found in the blood. And then that would be lower. That one would be lower. So that's all the tests that would be carried out. And then also it would be listening to the patient as well. So if the patient were, as I've said before, to be experiencing any new or increasing symptoms. So these can typically be pain. That is a different kind of pain, a new or increasing pain. Fatigue is another one. Peripheral neuropathy, like I was saying, the increase in I beg your pardon, the increase in infection, and also kidney problems can be something that comes up as well. So I think I've covered everything. Ellen, is there anything I've missed? Oh.
Beg your pardon, I was on mute there.
That's okay, don't worry.
You put me on the spot.
Oh, sorry.
No, I don't think so. I think you pretty much covered it all. Obviously, a bone marrow test is an important, and I guess give the doctor the big picture of what's going on in each individual. But there are other indications. Bone marrow biopsies are invasive. They don't do them as often as they used to, perhaps, but still give very, very important information. So you have to weigh up the risks and the benefits, I guess.
Yeah, thank you.
Great, thank you both. So I think we've got time for probably 1 or 2 more questions. So this one is a live question from Martin. Ellen, can you answer, does Zometa treatment need to be curtailed within a given time frame, or can it be given indefinitely?
Absolutely. I mean, certainly Zometa or zoledronic acid is a very, very important part of supportive care in myeloma. It's a drug called a bisphosphonate drug, which helps to protect the bones and stabilize calcium levels. It can't repair bone damage that's already occurred, but it goes a long way to preventing future damage from occurring. So it's a very, very important part of supportive care. Ultimately, the decision about how long a patient is on a bisphosphonate like Zometa, and Zometa is the bisphosphonate of choice, is a clinical one. So it would be down to the hematologist who has access to all of the patients' notes X-ray scans and knows the patient well. However, bisphosphonates aren't without their potential share of side effects, like all drugs in myeloma, I'm afraid, and bisphosphonates, particularly Zamita, which is probably one of the most potent of bisphosphonates, can cause things like that it's tough on the kidneys, so they would want to ensure that your kidney function was very good each time you have your Zamita infusion. It can sometimes cause this problem with the bones of the jaw, osteonecrosis of the jaw. It's quite a rare complication, but it does happen. So the bisphosphonates aren't without their potential share of side effects. We hear, and while there's nothing absolutely written in stone about how long a patient should be on a bisphosphonate, we know that most haematologists will prescribe bisphosphonates for around about 2 years. And then if a patient is in very stable, very stringent remission and no evidence of ongoing active bone disease caused by the myeloma, the Zamita can stop. But it would be restarted as and when a relapse occurred. But yeah, at the end of the day, it would be a clinical decision.
Great, thank you so much for that, Ellen. So I think we've got time for just one last question. This is another live one. So it says, how important is incorporating some form of exercise into life when in remission? Does it help with having a longer remission or just improving strength and mobility? Rebecca, are you okay to answer this one, please?
I am. Yeah, thanks, Mary. Yep, thanks for this question. So yeah, I mean, it is important to exercise. It can be really helpful when you are in remission, you know, and being physically active can be great for all kinds of things. You know, it can improve you physically. Also, it can be really good for you emotionally as well. You know, so getting out and about, doing the types of nice gentle exercise that we do say are appropriate for myeloma patients. You know, walking, gentle exercise. Swimming is a really good one as well. Things like this can boost your mood, and they can also really help with fatigue if fatigue is something that you're experiencing. It doesn't really have a connection to longer remissions or shorter remissions. However, what we do say is it's always good to be in the best physical and mental condition that you possibly can be should a relapse, you know, happen. It's always great to be just as strong as you possibly can be, and things like gentle exercise can really help with that. So yeah, like I say, walking, swimming, cycling are really good. Tai Chi is a really nice one as well, and all of these can really help to strengthen up the muscles.
Lovely. Thank you, Rebecca. Yeah, good advice for everyone, really, to try and stay as active as possible.
Yeah.
So that's all the time we have for questions today, unfortunately, but thank you both for answering those. That was illuminating for me. I hope everyone at home's found it as helpful as I have. So please remember that we are here to support you, and we offer so many services where you can speak to someone who understands. As well as the info packs and info sheets mentioned in the chat, we also have a range of publications that you can download from our website or order a selection of hard copies. All our previous digital Infoday sessions are up on our website and our YouTube channel, where you can watch them on demand. We have our peer buddy service, which provides the chance for you to tap into the knowledge and experience of others in a one-to-one setting. And lastly, we have a range of support groups from all over the UK, where you can meet other patients, carers, and family members. Myeloma is a very individual cancer, but you don't have to go through it alone. There are lots of ways to connect with others who know what you're going through. So we've come to the end of our event today. Thanks go to Ellen and Rebecca for speaking to us this evening. It's been absolutely fantastic. As I said, I have learnt a lot, so really appreciate it. We'd also like to thank everyone who's joined us tonight. We hope you found it helpful and informative. Thank you so much for submitting all those questions. It was, as I say, a good broad range of topics covered. If we didn't answer your question tonight, or this event has prompted some new questions, please contact us. You can do this via our Infoline or Ask the Nurse email service. Our contact details are on the screen just now, but you can also find them on our website too. Thanks to our supporters, Myoma UK can provide free digital events just like this one for patients and their families. However you choose to support us, your generosity will help us change the lives of people living with myeloma and their families. Once again, I'd like to thank you for joining us, and I hope you enjoy the rest of your evening. Good night.